During our discussion about communication, we reviewed that cognition changes under extremes of stress. Because of diminished ability to take in new information and restricted range of interests, people won't learn new things very well during a crisis. As a result, the ability to respond effectively is heavily influenced by how prepared a person is before the stressor or disaster occurs. It's good to remember that luck and good fortune can be helpful, but the Louis Pasteur quote here should remind us that being prepared often increases our chances of success. Beyond the information we obtain to feel knowledgeable and enhance our own skills, there are many pragmatic steps that can be taken, which often involve minimal investment of time and resources. But taking the time and energy to get prepared isn't very exciting and can feel downright boring. It's a task that's easily overtaken by the challenges of everyday life. I was working in the field of disaster mental health for a number of years before I had a go bag and other items in my home to ensure my family's basic needs were met during, say, an extended power outage or loss of water. It was around the same time that my family developed a fire evacuation plan that my daughter was even involved in creating the drawings for. For healthcare providers, being better prepared personally and professionally reduces distractions when a disaster occurs and increases the ability to focus on supporting our families, our patients, and our communities. And in some ways can involve our children and other members of our family and community so that they themselves feel more comfortable and better prepared. For patients, research has indicated that those with active mental health conditions, particularly serious and persistent mental illness, are often less prepared than the average citizen, creating increased vulnerability for them during disasters. This is likely related to issues such as diminished cognitive skills and reduced motivation that are common clinical features of many disorders and can obviously be side effects of medications as well. Unfortunately, this often means those in greatest need of preparedness efforts are most impaired in their ability to take the necessary steps. Helping patients to be more prepared for things like climate-related disasters or other crisis events that might limit or alter their access to care can reduce their distress, increase confidence in their own ability to manage these challenges, and improve continuity of care during disruptive events. These are steps that can help ready your practice, identifying those who are likely to be most vulnerable, which for many of us is a smaller percentage of our patient population. Those would be the people to focus on the most, ensuring people have adequate medication supplies and ongoing education to refill medications in advance and avoid waiting till the last minute. These are good general practices to reduce difficulties when any type of unforeseen event occurs. But they're also helpful during disasters when access to medications may be disrupted. Also developing a plan for how we will access patients' records and how patients will access us or other systems of care. Establishing linkages with primary care and emergency settings are ideal because these are the locations that most people show up in crisis or for any medical needs during a disaster. For an organization, it can help to think about what role you want to provide during a disaster. Sometimes this might change when the disaster occurs, but considering this important question in advance allows you to develop plans, establish routines, and obtain resources. It can be useful to simply look within your organization for expertise. Do you have prior military personnel or emergency responders? Are there other personnel who have lived through or helped manage disasters with either formal or on-the-job training? Most people who become involved in disasters and preventive psychiatry did so as a result of lived experiences. Tapping into these resources can be invaluable. Developing protocols and lines of communication help ensure continuity when a disaster occurs. If you're part of an organization where people work together routinely, then having drills or exercises to practice implementing crisis and disaster protocols and procedures can also be helpful to help identify and shore up holes in plans and procedures. Disaster and preventive psychiatry resources are important. When you need to access useful content for self-directed learning, educating others, or accessing rapid response resources, the disaster behavioral health curriculum recommendations can be a valuable resource. This curriculum recommendations document is the first of its kind and the byproduct of a collaboration between the Center for the Study of Traumatic Stress and the National Center for Disaster Medicine and Public Health. The table of content lists 10 core topic areas in disaster behavioral health. These are linked to more detailed sections that further outline relevant subtopics. For any given topic, users can quickly link to a list of educational materials, including rapid response resources, fact sheets, mobile apps, journal articles, technical reports, and other items. The resource index was developed through an extensive review of the literature in collaboration with global disaster mental health experts, selecting resources found to be most beneficial, easy to use, and representing seminal work in the field. This document's in the public domain and free to access and to use and share. The Center for the Study of Traumatic Stress has nearly 200 disaster mental health education fact sheets with numerous resources for healthcare workers, families, and community leaders to address unique aspects and impacts of disaster events. They're brief, easy to read, and provide actionable guidance to help you know specifically what steps to take, as well as some to avoid. They provide recommendations for ways to enhance the essential elements of psychological first aid in support of individuals and the communities in which they live and work. You'll find resources that you can use and share with others, which provide action steps for enhancing well-being and promoting recovery following a range of disasters, including mass violence, extreme weather events, pandemics, and more. These resources are free to use and to share. For a helpful overview of research on how climate change impacts mental health, you can use this federal report on the impacts of climate change on human health, which was directed by the U.S. Global Change Research Program, a confederation of the research arms of 13 federal agencies. It was the first federal document that focused exclusively on health-related effects of climate change. The chapter on mental health and well-being summarized what was known about mental health effects of a changing global climate, and much of that knowledge has emerged from the study of disasters. You might also be looking for resources specifically addressing issues related to COVID-19 and mental health. The Asper-Tracy database contains a wide range of resources on numerous topical areas for many different audiences. It's organized by topic area and contains some excellent content. The Center for Traumatic Stress's COVID response page also has resources that are brief, straightforward, and action-oriented. They address the broad range of challenges that have occurred throughout the pandemic, from how to begin talking with children about COVID-19 and what it is, to supporting healthcare workers and keeping their families safe from illness at home, and often overlooked issues such as grief leadership. The resources at both sites are all free to access, use, and share. You might also find it helpful to access online training in these core content areas to prepare yourself and your colleagues to respond to disasters. Some residency programs even have their interns complete online training in psychological first aid to enhance their skills in managing people in crisis, whether that's a disaster or any other crisis event. The National Child Traumatic Stress Network has an online training in community-based psychological first aid to help with supporting the well-being of adults and children affected by disasters. The training module puts participants in the role of a provider in a post-disaster scenario, and it's free to use and comes with continuing education credits included. Another free online training in psychological first aid was developed by the National Association of City and County Healthcare Organizations, and this is geared to people who are or hope to be supervisors or leaders. It was jointly developed by the Behavioral Health Section at the Federal Office of the Assistant Secretary for Preparedness and Response. These are the folks that play a vital role in coordinating national disaster behavioral health response efforts. Also, the Massachusetts Medical Society adapted principles of psychological first aid to create a brief COVID-19 specific education module to promote psychological recovery from the global pandemic. APA has several modules on disasters, including climate-related disasters and mental health, as well as practical application of military lessons for use in non-military disaster settings. There's also an outstanding new educational resource from the American Academy of Child and Adolescent Psychiatry that incorporate lessons learned from COVID-19 into broader training of disaster mental health knowledge, skills, and attitudes in the care of children and adolescents. Mobile apps can be another helpful tool to better prepare for disasters. The Behavioral Health Disaster Response app, developed by the Substance Abuse and Mental Health Services Administration, provides a range of resources that you can share with others and helps connect you with local resources during a disaster event. There's also information about maintaining self-care, which, as we've seen, can be challenging during a disaster. The PFA mobile app allows you to quickly access summaries of the 8 core PFA actions and provides tips for applying these to support those affected by disasters. It also allows you to conduct assessments and track referrals to care when needed. Both apps are free to use with no hidden charges. Investing in preparedness can be time consuming and many will question the benefits. One area that's often critical in resource allocation is determining the business case for investment. In fact, there have been efforts to quantify the financial impact of common mental health disorders using cost modeling estimates of those impacted by Hurricane Katrina and Rita, and the subsequent expense of screening the affected population for depression, anxiety, and PTSD, assessing those that screen positive, and providing evidence-based treatment interventions. When we think about the cost of managing these adverse mental health effects, we can keep in mind that $14.2 billion was spent to secure barriers and levees that were in considerable need of repair even prior to these hurricanes. And this securing of the levees happened in 2015 or was finalized in 2015, long after the hurricanes occurred. Interestingly, Schoenbaum and colleagues estimated it would cost $12.5 billion to screen and treat those 3 common mental health disorders brought about by the devastation of the hurricanes that were in no small measure the result of dysfunctioning levees. Also consider that this financial estimate doesn't account for property damage, lost work productivity, economic revenue, potential adverse events like the development of substance use disorders or suicidal behavior, or family or other interpersonal conflict following the event, or even the human toll of grief, loss, and suffering. For almost the same cost as managing these 3 mental disorders alone, the levees could have been secured to prevent the devastating floods that caused the vast majority of damage, injury, displacement, and adverse mental health and other effects. In this single example, these numbers present a compelling argument for rigorous and ongoing evaluation of a business case to better understand the costs and benefits of disaster preparedness. The vulnerabilities in the levees and barrier systems were well known and documented for decades, and the impact of their anticipated failure had been clearly communicated. What might have been prevented had they been addressed before the storm? So in summary, we've talked about the differences between direct clinical care and public health interventions, and many of the roles that we can play in disasters. We reviewed the range of psychological and behavioral reactions for individuals and communities, including things well beyond disorders that occur earlier and more often, like distress reactions and health risk behaviors. And we considered aspects of vulnerability across time, before, during, and after disasters, as well as being cautious about our assumptions around risk. We talked about the basic principles and actions of psychological first aid and how that can help improve well-being, reduce distress, and enhance functioning for individuals after disasters occur. We also thought about some unique ways that we can adapt crisis interventions and how that can be very beneficial during unique disasters like COVID-19. We thought about the importance of using communication as a behavioral health intervention to foster essential elements that support communities after disasters. We considered knowledge, skills, and resources to support communities and provided you with some important resources and links to items that may be helpful for you in supporting your patients and other people in your communities, as well as some important thoughts about being better prepared, how that can help us all to function more effectively in disasters.